God bless you, vessels of honor. This is Dr. Brenda Bowers, and I am here with our COVID-19 update for the state of Wisconsin, for Milwaukee County, for the impact of the city of Milwaukee, and then a global view using our colleagues at Johns Hopkins global database that's so very informative for us, as well as all the databases from a state, county, and municipal level. I'm thanking God for being here. We call this the Because We Are in the World segment, and then I also do one that then is called Because We Are Not of the World. So because we're in the world, there are things we need to do as good citizens, but because we're not of the world, there are things we must do in order to stay as ready vessels equipped during such a time as this. So with this update, I give this cursory overview from a position of being able to support those who just are not interested in digging through all the data and how much do we really need to know, what do I need to do individually, and how can I cope during these times. So with that in mind, I work to keep this 15 minutes or less so that you kind of hear the key things that have happened in the course of the day and walk away equipped, knowing what to do while you are in this world. And I am drawing from my education experience and expertise in the healthcare field. I am very happy to share what I can with you, and I am learning along the way. One good thing about becoming more and more focused and specialized, generalized, educated, the big thing as an adult learner is remembering that we are lifelong learners. We're always learning from each other. So today in Wisconsin, Friday, April 3rd, 2020, there are now more than 2,000 positive cases of the novel coronavirus that we are referring to as COVID-19. There are also, however, over 20,000 cases in the state of Wisconsin that have tested negative, which lets us know that we have performed more than 22,000 tests. So remember, one of the ways that we are able to flatten the curve, kind of this new jargon and dinner table saying we want to flatten the curve, and one of the ways we do that is increase the number of tests, and then we're able to really see that gap that exists between negative test results and positive ones. So in the state of Wisconsin, if you go to the website, the actual website, then you will see 49 deaths listed. At 2 o'clock, that was then changed to 37 deaths listed. Our colleagues at the state have been very diligent in letting us know that if there's a question in the data, always allow the source of truth to be the source of the data. And that would be at a county level or at a municipal level. So then that's why we kind of peel back a little more and say, okay, that's that cursory view at a Wisconsin level, but what does it look like when we really look at maybe Milwaukee County, the largest county within the state? And we're going to do exactly that. But one of the other data points that have been added that is a good add, in my opinion, is the number of hospitalizations of those that tested positive. So of the 2001 positive results that we've had of COVID-19, 487 of those have had to be hospitalized. So still, the large majority are able to recover at home, being in quarantine in their own environments, which is always healthier and better whenever we can do that. So being positive doesn't equal mortality. Everyone who's positive does not end up in a fatalistic state. In fact, only 25% of those who are positive actually even get hospitalized. And that's important for us to know from a state perspective. Now, when we look at the Milwaukee County dashboard that is updated on a daily basis, the Milwaukee County dashboard is showing us 1,023 confirmed cases in Milwaukee County with a death total of 24 individuals. That is their update, and that was updated, they say, an hour ago. So it is 7:40 where I'm at right now, so around 6:30 this was updated, and that is the information that we're showing. Of that 1,023 positive cases in Milwaukee County, 797, or almost 800 of those cases, are in the municipality of the city of Milwaukee. Today, Racine County, who has 46 positive confirmed cases, reported their first death. Kenosha County reporting 90 positive or confirmed cases, and Sheboygan County following at 21 confirmed cases. For the first day, Barron and Rusk counties are showing up on the map as reporting Barron County 3 confirmed and Rusk County 1 confirmed. I do take the time to show you that dashboard so you can see what that looks like. And here it is for us today. So as we look at the Milwaukee County dashboard, you are able to see in the bottom left, I always point out that furthest left is the city of Milwaukee, and then you see across the bottom how those numbers really become very small. So as we look at Milwaukee having 797 of the 1,023 confirmed cases, the next largest is 39, then 28, 27, 24, all the way down to 2 we see on the very right side and of that table in the left corner. And then on the bottom right corner, you're able to see again that trend up. So we're still trending up, but so you may have heard that the state said, hey, there's a ray of hope out there. You see the stratification, I'm going to speak to that in a second, but you see the stratification from the age range. That's getting less. The distribution between the age group is becoming tighter, so you're not seeing as big of a spread. And then you see the confirmed deaths in the top right corner. So as we look at various ages are now being impacted differently than at first 2 weeks ago. That looked very differently, and we're still going up. So then there was this comment today from the state that indicated, hey, there's a ray of hope. That is because the rate of the increase seems to be slower. Again, the testing has increased. So I'm not going to get into the semantics of who's right, who's wrong. Are we getting better? Aren't we? The key is to stay focused on you. If every single person would take care of themselves, then the cure for the world it's inevitable. In my book, World Changers and Difference Makers, it's really all about us taking responsibility and transforming ourselves. And if we transform ourselves, then we're able to mend the world one person at a time. There is no time greater than right now for us to focus on and do that. I also wanted to indicate something that's really cool in the state of Wisconsin today. They have started a resilience effort, and there is information and vessels of honor. I'm going to ask for our colleagues in the area of behavioral health to post the Resilient Wisconsin. It's almost like a white paper, but it really talks about why Resilient Wisconsin, and then things that we can do to really keep our mental, behavioral, physical health in good condition during these times, like making sure that you have good food, good sleep, good exercise every day, staying connected with your support system, finding positive distractions versus negative distractions, reducing anxiety by reducing risk, washing your hands, not touching your face, washing your face if you touch your face, or even as you're out when you get in, wash your hands and your face. And then check in with yourself and make sure that you're being true to yourself. And hey, how am I sleeping? Am I irritable? Or do I demonstrate great fatigue? Is my stomach hurting? Have I eaten today? Have I gotten in enough nutrition? So it is important for us to be resilient and be able to bounce back during these times. So bouncing back is critical. And I really liked what the governor said, Governor Evers. He said, together we can build a healthier and more resilient Wisconsin. I am such a proponent of building resilience. I was very excited to see this ad today. So building resilience is the ability to adapt and recover from adversity within ourselves, our relationships, and in our new community, and that matters. When we find healthy ways to cope with trauma and toxic stress, especially during the tough times, we take a step closer to becoming more resilient. Resilient Wisconsin, per our governor, is here to help by bringing together the latest mental and behavioral health self-care tools and trauma-informed practices. Through Resilient Wisconsin, people living with or affected by toxic stress or trauma and the professionals and programs that serve them can find the support and resources that they need as Wisconsin residents deal with the stress and uncertainty of the COVID-19 pandemic. Helping our communities find healthy ways to adapt and stay connected is more important than ever. Resilient Wisconsin is here to help by bringing together the latest mental and behavioral health self-care tools and trauma-informed practices so that people living with or affected by toxic stress or trauma and the professionals and programs that serve them can find the support and resources they need. So that is, I've read to you what is posted. You can go to dhs.wisconsin.gov and then it's /resilient, and you will find Resilient Wisconsin. We will make sure to post that, Vessels of Honor, on our GroupMe. So lastly, before I let you go, I'm right at a 12-minute, almost 13-minute mark. I do want to go back and look at our Johns Hopkins. I will refresh it before I share it with you. This is that global look. As we're looking globally, right before I turn it and show it to you, I wanted to make sure I was getting some of the U.S. data that you would be able to see when I turn it around. So this is from our colleagues at Johns Hopkins University of Medicine Coronavirus Resource Center. That global view. So this is what the world looks like as it relates to the coronavirus. So there have been over 1 million total confirmed cases, and you see that on the left-hand side, that leading confirmed number is the United States at 276,995 confirmed cases. This was updated at 7:02:47 p.m. Friday, April 3rd, 2020, with 181 reporting countries and regions, and I've gone over that with you before. So as we look at the globe in this map format, we see where the red is in those condensed areas of total confirmed. So where there's the total confirmed, the red, we see the United States has 276,995 that have been reported. Don't minimize the fact that we're doing more testing. And then as you look over to the total number of deaths so far, 59,000 of that million, 59,131 deaths. And again, one death is one too many to be lost to this virus. But when we look at the percentage of 59,000 deaths over 1 million, from over a million that have tested positive or been confirmed, then we are grateful that the invasiveness of the virus is not any more aggressive than it is, and it is aggressive. And what we're doing with our social distancing is a good intervention at this point in time. But as you look at those deaths, I did scroll down a little so you could see some of the U.S., because the number of deaths, when we get to the U.S., you have to scroll through that whole list. If you look at, Wayne, Michigan, U.S., 223 deaths. King, Washington, U.S., 186 deaths. And then also total recovered, 225,942, much larger number than the death number. And you see the U.S., I pulled it up there so you could see it, has reported 9,772 who have recovered. That number would be against this 1 million number. And then at the bottom right, we see we are still moving upward. So we're hoping that we're starting to get that curve to at least start so we can start moving down in the right direction. That is your COVID-19 update. I am your coach and colleague, Dr. Brenda Bowers. Please give me feedback. Let me know if this is beneficial. I'm doing this thanking God that I am here to be able to speak with you as I continue to be convalescent in many ways and recovering. God has blessed me at this time to be in the world, not of the world. So I share me with you, and I hope that that is beneficial. Until soon, which prayerfully will be tomorrow, take care of yourself, hand wash, and be safe, be sound, and be sensible. Until soon, love and peace.